So you ask, can a woman suffer from erectile dysfunction or ED? Well, the reality is that the most common sexual dysfunction of women is loss of sexual desire. It happens commonly in early menopausal women and postmenopausal women, but it also happens in women on contraception and much younger women where the element of distress is much higher because they expect to be perfectly sexually functional. What about arousal disorder? Arousal disorder is in fact the female equivalent of erectile dysfunction. Arousal disorder stems from a reduction in the blood flow to the clitoris and surrounding tissue, which results in reduced arousal. Arousal to a woman is usually associated with clitoral swelling or the tingling sensation she gets in the clitoris and lubrication of the vagina. These functions can be lost due to physical constraints. Those physical constraints may be a reduction in blood flow after a surgery like a hysterectomy. They can occur in older women who have vascular disease like cardiovascular disease, heart, peripheral vessels, and in this case the blood vessels in the pelvic organs. And it can also occur both as a result of failure to dilate those blood vessels and also due to psychological problems or a mixture of those two, so-called psychological, physical, or both. There are some treatments that seem to work for arousal disorder. They include medications that stimulate the blood vessels of the clitoris, labia, and vagina to dilate more easily, and other even over-the-counter preparations that increase tingling in the area and blood flow in the area. There are two over-the-counter preparations that are used in women with arousal disorder. They are Intense and Zestra. The diagnosis of arousal disorder usually involves a consultation with a mental health professional to make sure that it isn't in her head, so to speak, but it also involves a biologic endpoint, an attempt to make sure that blood vessels in the vagina and around the cervix are capable of dilating. This can be accomplished through a test done in the office without any pain called impedance plethysmography, a big long name for basically a way of measuring the dilation and blood flow in the vagina. Treatment for isolated arousal disorder, in addition to the over-the-counter medications I've mentioned, includes medications to increase blood flow generally and to increase the impact of arousal, psychological arousal, on blood flow in all parts of the body. Such treatments are usually reserved for individuals who have cardiovascular disease or peripheral vascular disease. Don't suffer in silence. If some of our discussion today sounds like problems you're having, don't hesitate. Go to your health professional and seek some attention. Women commonly subjugate their own needs to those of their children and their families, or subjugate their needs to their husbands and partners. You need to take care of yourself. If you're not happy, the rest of the family won't be either. If you need help and can't find it, contact us at the information listed below.